Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and MC here at Gold. And here I have a special guest with me today, Dr. Rebeccah Slater. Welcome, Rebeccah, and welcome back to Gold.
Hi, Kristen. Nice to see you.
So you are part of our Gold Neonatal online conference. We get started just in a little bit. The conference opens on June 3rd with a keynote presentation that is open access. But your topic is titled A Brain-Derived Approach to the Measurements of Pain in Infants, a very, very important topic. We want to get into that in just a moment. But first of all, tell us where in the world you are and tell us a little bit about your professional background.
So my name's Rebeccah Slater, and I'm based at Oxford University, and I work in the neonatal unit here at the John Radcliffe Hospital. I've been working on pain in babies for the last 20 years or so, really trying to find better ways to measure and understand pain in early life.
Wonderful. Yes, and I know you have studied this topic. This is your specialty, and you've poured many hours of work into that. And I can imagine, we've learned so much over the years about pain. I remember there was a time when we said, "Oh, these little ones, they don't feel any pain," and not much was done for pain management. So, walk us through the development. You said you're doing this in over 20 years. How this developed and where we are now.
A long time ago, there really was an underappreciation of pain in very young children. And in part, that was because people were quite worried about the side effects of analgesic drugs. And so, in the absence of knowledge, it was sometimes safer to think maybe that the pain that they were experiencing wasn't so bad compared to the potential effects of these drugs. But over the last 50 years or more, there's really been a revolution in understanding pain in these young children. And it started off with a lot of work looking at changes in facial expression, which are really important because if you do something painful to a child, you can look and you can see the kind of impact you're having on children's behavior. But for me, a really important turning point in this was around 2006, when we were able to show some of the first changes in brain activity that were occurring when we were doing painful things to babies. And so we were able to see that nociceptive signal that was coming from these painful events was going to the brain, and then we were able to record it. And it really has been a lifetime's work to think about how you can use these recordings of brain activity to better understand pain development in early life, but also to think about the impact of different analgesic treatments, both pharmacological treatments and non-pharmacological treatments.
And this sounds to me like a far more objective way to measure pain than just looking at facial expressions, especially since little ones, if they're born very early, they might not be able to, have all these facial expressions that older babies or children have when they experience pain, correct?
Yeah, so one of the benefits of using these brain-derived measures is that we can quantify the changes of the noxious input that's reaching the brain. Whereas if you're looking at a baby's facial expression, it can be harder to interpret what those facial expressions mean. Obviously, babies will make lots of facial expressions, whether they're in pain or they're tired or they're hungry or they're cold. And so that can be a little bit more challenging if you're just relying on facial expression. But your point's also really relevant. If a baby has a ventilator over their mouth that's perhaps covering quite a substantial proportion of the face, it might be a little bit more difficult to see these facial expressions and therefore a little bit harder to quantify them.
Absolutely. And you mentioned, analgesics and medication for pain relief, but there's also other ways for pain relief. And I believe you're also looking at a parent-centered approach while measuring that, correct?
Absolutely. I think this is really important. So parents are they're advocates for their children and they're often present when these procedures are happening. So working out how we can harness the power that they have in order to make the experience better for the babies is something that I'm really passionate about. One way of doing this is giving the parents the opportunity to touch their baby during these painful procedures and to see if that parental touch can reduce the pain that we experienced. Now, we've done a few trials on this, and while we've shown that stroking babies can be very beneficial in an experimental setting, we've got a little bit more work to do to work out the best ways to encourage parents to handle and touch their baby during these procedures, and then to see whether this touch can actually reduce some of these painful signals that are going to their babies' brains.
Beautiful. I can't wait for you to come back to give us more information and deliver more research on that topic because it sounds absolutely fabulous because the parent is the expert on the baby and it gives so much also as a parenting tool for the parent who sees their little one in the NICU who often feels, oh, this is not my baby. Nurses and doctors are taking care of it, but that's something they can be parents about and be there and comfort their little one. So now walk me a little through the presentation if you don't mind. So what can we look forward to and what you hope our viewers will take away from this presentation?
So, really, I want people to see the value in thinking about what's happening in a child's brain when we do all sorts of different things to these young children. Whatever we do in our environment, be it talking to the babies, handling them, touching them, or doing these medical procedures that are necessary, signals are going to be being sent through the nervous system to the brain. And we now have the ability to record some of these changes in brain activity and think about how we can use them to ultimately provide better care for children, but also better understanding of how the nervous system matures so that we manifest the ability to experience pain. And so, for example, we can look at how, when we're able to discriminate between painful and non painful stimuli. And I think the new techniques that I'm describing can add a lot of value in thinking about these questions.
Absolutely fabulous. Thank you so much, Dr. Rebeccah Slater, for being here with me today, talking about the important work that you do and also about this presentation here for us at Gold. Thank you so much. It was a pleasure having you here.
It's a real pleasure to be invited back. I gave a talk to you many years ago for a gold lecture, and it's a pleasure to be able to update it with all the new insights that have happened over the last 10 years.
New insights indeed. Thank you so much. We can't wait for your presentation, a brain-derived approach to the measurement of pain in infants. So a little bit of information for our viewers. If you're interested in this presentation and to learn more about the other presentations in the conference and the add-on packages, we invite you to go to goldneonatal.com for more information and check out, we have 2 free keynote presentations that are open access. You can sign up for those as well. Thank you again for watching and participating here with us at Gold today. Have a lovely rest of your day. Bye-bye, everyone.